What is the cost of the gynecomastia surgery? The cost varies anywhere between 65 to 90,000 plus 18% GST. It's according to the size of the gland. You have to understand, because the hospitals will charge according to the hourly, how much hour we take. So according to the size of the gland, your rates vary. Some poor people we do help, and when they don't have, when really needed patient but they don't have money to pay us, so we do operate at a very minimal cost. You have to contact us, contact our center and find out about these things further. Sir, I have only 2 days after surgery to go back to my country. Is it okay? Absolutely okay. Normally 48 hours you need to stay in Chennai. Third day you can fly back. Restrictions, other restrictions like you should not drive the vehicle for 10 days and you should not do the cardio workout for 15 days. You should not do a heavy weightlifting and swimming and tennis and all for 45 days. These restrictions you have to follow if you go back to your country also. Okay, so after 48 hours you can fly back. Even first day we remove the stitches and we put a glue. One day we'll observe you again, then we can go back. So 2 days is more than adequate. I have a bigger areola. The black color skin surrounding the nipple is very big and it's very projected. It's puffy. Will it comes down after surgery? This other common question usually people ask for. See, usually because of the glandular activity in the gland, it pushed and it will, so that areola will be so much stretched. After the removal, even the bigger areola will shrink, becomes almost normal. See, a lot of people they ask for this areola reduction also during surgery. But I always ask them to wait for some months and we see how it settles. If it is not settling, we do the areola reduction separately. But none of them came back for the areola reduction till today, because once the gland removed, they are very happy about the results. They don't want the further areola reduction. That's what my experience is. Do I have a psychological problem or I really have the gynecomastia issue? See, a lot of people most of the time it happens in the grade 1 gynecomastia, very minimal gland. When you remove it, they won't be happy. They come back and say few typical sentences that says that you have a psychological problem. One thing is, they say that when I walk in the road, everybody look at my chest. They are not look at my face and talking. And same way in the office space, all the girls looking at my chest and giggle, and we feel very uncomfortable. These two things will tell you that you have definitely a psychological issue. It's called body dysmorphic disorder. You have to meet a psychiatrist and consult them. They might ask you to go for a cognitive behavioral therapy, or they put you into some mild antidepressants to you come out of it. Don't struggle in this space. You are all in the very active age, like 20 to 30 years you come. Most of them with this kind of a complaint, they spoil their whole career and they spoil their life. So it's very easy to correct. Go for a cognitive behavioral therapy counseling sessions, or meet a psychiatrist. They'll help you with a few medications which really helps. Better than anything, this kind of a treatment, you have to change yourself. I should not think about it. You keep a diary. Today I thought about this for 7 hours. Next week probably 4 hours. Slowly reduce. Try to reduce the time. Try to involve in very serious work and focus on your life and develop some passion. When you don't have a passion, only you divert your mind into these things. Understand this. See, if I have a large gland and sagging breast, what is the options? See, if you take any Western literature, any Western, like US and UK websites, you can see a big scar in the chest when they put a free nipple graft above that. It's called double incision mastectomy and free nipple graft. But to the extent from the muscle, if your nipple areola is up to 3 inches, that option is not necessary at all. You can do simple gland excision and liposuction properly, and do some kind of a plastering techniques which really helps in the bringing back your areola to the normal position. So you don't need to go for a bigger surgery like that. But usually, why they are not worried about the Westerners, why they are not worried about the cut in the chest is, for them scar heals very easily. You won't even see the scar. That's the reason they don't worry about making a bigger cut and putting a bigger, like a incision to clear this issue. But in our darker skin people, the scar is going to be worse. Idea is to remove the shirt in front of others. When we have a bigger scar like that, no point in going for a surgery. Yes, in extreme cases, it's very pendulous, very bigger, you need to think about it. Even most of the cases in our scenario, you do a liposuction gland excision. After 6 months, still you feel a little loose skin, you can go for the circumareolar skin excision. That is a purse string suture and areolar skin excision. Just remove the excess skin and tighten it like a purse string. That helps a lot than going for that. Also gives a scar only around the areola, not a bigger scars. So doing as a staged procedure always better in bigger glands and bigger, like with a pendulous breast. But understand this. What are the causes of gynecomastia? Usually in 3 age groups you can see the gynecomastia. One is newborn, usually through the transplacentals, like the hormones comes from your mother to the child through the placenta. So little bit excess, the estrogen will produce a mild glandular element, it automatically settles. But commonest age group what we see is the physiological, the pubertal age group. Around 12-13 years, even nowadays guys, even 10 to 13 years we can see kids develop gynecomastia. So the commonest cause of this gynecomastia is usually male body has both male and female hormones. There is like a little confusion between male and female hormones, which hormone to come first. So the female hormones comes and the estrogen comes, exists and forms the glandular element. But the confusion settles in 1 or 2 years time. Then, but whatever formed is the gland, it settles. If you go in depth into it, so the pathway for the testosterone formation and the estrogen formation is always almost the same, except the last step. Okay, that aromatization we say, from testosterone to estrogen, only one step. Because of that conversion, so usually a lot of estrogen also forms during the pubertal age. So testosterone slowly increase. When liver can't handle that excess testosterone, automatically it converts the testosterone into a estrogen, so that the gland forms. This is the commonest thing. Third age group what we normally see is the older age group, where testosterone level comes down and the peripheral conversion of that estrogen to testosterone happens slowly. So the old age people tends to get the gynecomastia. That's also very normal. But when the old age gynecomastia, you have to rule out any testicular malignancy also, because some kind of a testicular malignancy, the balls have the malignancy, the cancers. Obviously that also produce some kind of a hormone which produce testicular the gynecomastia. So other causes, what are the causes you get gynecomastia is even the thyroid hormone excess secretion might cause gynecomastia. Even liver failures will cause the gynecomastia, and if you have excess alcohol intake, it causes gynecomastia. Even some excess drug intake like a marijuana excess will produce the gynecomastia. And if you're not developed the secondary sexual characters like a beard growth, or even your testis volume is less compared to normal people, you need to think about other causes. So you have to meet a doctor to find out these things when you have other associated problems. So these are all the wide range of causes which causes gynecomastia. What is normal chest? What is a normal male chest? You have to understand this to understand the results what you need to get after the gynecomastia. The normal chest, you have to concentrate on the pectoralis major muscle, that is the chest muscle. Okay, the chest muscle, when it forms from here, the border of the chest muscle, when it goes from here all the way down like this, your nipple areola has to be 1 centimeter above and 1 centimeter from the sides. That should be your nipple areola position. The side of the fat has to completely be flat, and below the muscle should be completely flat. Only the muscle bulk has to be visible with the the nipple areola, as I said, 1 centimeter, 1 centimeter rule. Okay, but the major problem what we face in gynecomastia is the nipple areola will be very much below the muscle border. The whole concept of the surgery is, in my experience, what I feel is the bringing back the areola back to the chest muscle is the biggest task of any plastic surgeons. So getting that back is a difficult thing, and so that value also important in any gynecomastia surgery. So if you get a proper shaped muscle, the other fat are completely removed and the areola is above the muscle, we achieve the results. That's what I feel in the gynecomastia surgeries. That's what very important in gynecomastia surgeries.